In this video we will talk about hemolytic uremic syndrome, also abbreviated HUS. Hemolytic uremic syndrome is a type of anemia that can occur mostly in children, and it can also lead to a low platelet count, and sometimes it can lead to nephropathy. So it's very serious, and 90% of the time it happens in children less than age 5 years. So it's a pediatric diagnosis, really, most of the time. And the cause is basically contaminated food. Contaminated food is a common reason for many illnesses, but this is one of them. And really what we're talking about is E. coli and sometimes also Shigella. And what happens is these organisms secrete these toxins. These virotoxins are also known as Shiga toxins, and these toxins are really what cause all the damage. So contaminated food and water, actually, really where these bugs live. It's very important to avoid these. We'll talk a little bit about prevention a little later. So what happens? Why are these toxins so damaging? Well, what these toxins do is they go and bind to the kidney, the glomerulus, glomerular endothelial. They bind to the endothelial cells in the kidney, and that causes cell damage and can eventually lead to the breakdown of the red blood cells. This leads to anemia, and this process can also result in the destruction of platelets and in renal insufficiency. Now, we'll talk a little bit more about the diagnosis and how you can actually tell that this is actually happening. But first, let's just go through this step by step, starting with the history. So a child comes in, let's say the child is 2 years old, and the parents tell you, that he's possibly eaten some, contaminated food, and there's a long list. Beef, I should put the word in contaminated because that's really what's causing this. Beef or cheese, poultry, chicken, even vegetables. And then maybe drank some water that was not clean. And then what are the symptoms? So this is a little bit about the history, but then what are the symptoms? Well, these are the symptoms. Abdominal pain. Okay, a lot of these are very vague, could be anything, but kind of helps to narrow it down. This one here is a big one. Anytime you have blood in the diarrhea, that's always a problem. Bloody diarrhea is always a huge problem. Nausea and vomiting. Okay, nausea and vomiting. Interestingly, absence of fever. Absence of fever is kind of an important part of the symptoms. So these are some of the symptoms, and then of course we're talking about the pediatric population, so this is part of the age, I guess. Well, this is your symptoms and history. What do you do? How do you proceed at this point? Well, this is the diagnostic process. Some of the basic tests that you would order: CBC, and as you know, this has the hemoglobin, hematocrit, and the platelet count. Okay, you would probably order the whole comprehensive metabolic panel, but what you're really looking for is the kidney function, creatinine, BUN. Another thing you want to probably order is a peripheral smear. Peripheral smear, and this will show you. And I'll show you exactly what this will show you. It will show you this. Now remember, we talked a little bit before about how these Shiga toxins essentially cause fragmentation of the red blood cells. Fragmentation of RBCs. And when that happens, the fragmented parts are called, there's a special name, schistocytes. And these arrows on this, this is a peripheral smear, this right here. This is a peripheral smear. and I've seen this on licensing exams. And this peripheral smear is of a patient with HUS, okay? And this is the anemia, and these arrows here are pointing to the schistocytes. As you can see, these are fragments of red blood cells directly caused by the Shiga toxin. So that this is a nice picture of a peripheral smear. Going back to the diagnosis, so you've got these main things. There's a couple other tests, that are involved in the evaluation of hemolysis. You probably have heard of these. And then what you also want to do is do a stool culture. Remember, the patient will have bloody diarrhea, so you want to do a stool culture to try to see if you can isolate the organism that's causing this problem. Now we'll talk a little bit about the treatment. How do you treat HUS, hemolytic uremic syndrome? Well, there's a few things. The first thing is you need good hydration. Anytime somebody has diarrhea, they're going to lose a lot of fluids, so you need to give them IV fluids. Okay. One thing I wanted to mention before we even get into this is you really need to get some specialists involved, and those specialists are a hematologist and a nephrologist. Now, this is a big problem in third world countries because as you can imagine, this type of illness occurs a lot in third world countries where you have a lot of contaminated water and food. But unfortunately, third world countries, very difficult to find a specialist, and sometimes even difficult to find a general doctor. So a huge issue here. Going back to the treatment, hydration is very important. The next thing that you need to do is you need to monitor their blood pressure, because as you're hydrating the patient, their intravascular volume will increase. But because their kidneys are affected, they may not be able to urinate properly. They may develop oliguria. So as a result, the blood pressure might rise. So that needs to be monitored, and if it is indeed affected, then calcium channel blockers are used. So that's a little bit about the hydration, fluid status, and blood pressure. Now the big one, really the big thing that saves a person's life in HUS is red blood cell transfusion. That's how you basically save a person's life. And without this, the patient will die, plain and simple. And approximately 50% of the time, the patient might require acute dialysis because their kidney just isn't working properly. Now we talked about the treatment. Let's talk about what you need to avoid. A lot of common mistakes. Avoid these things. Do not give antibiotics. Interesting, I think. Do not give anti-motility agents to stop that diarrhea. Motility agents, antidiarrheal agents. Do not give those. All right. And finally, I want to talk a little bit about prevention. Prevention, especially in third world countries or anywhere really, it doesn't have to be just third world countries. It could be in North America as well. Is really you have to have sanitary measures when it comes to food. Sanitary measures are important. You have to make sure you cook the food properly. You have to make sure that you avoid unpasteurized milk. You have to wash your hands. That's really it sounds like a simple thing, but it really prevents a lot of these food-related, water-related illnesses. Just as a closing statement, this is a diagnosis that has personal relevance to me because I had this when I was a child. I was approximately 2 years old, and I had hemolytic uremic syndrome, and I almost died. I pretty much had 48 hours to live, and the only thing that saved my life was right here. This is what did it, and I'm obviously around today because of this. So I hope you enjoyed this presentation about hemolytic uremic syndrome.